Hi there.
Hi.
Hi, my name is Dr. Semide.
Hi, my name is Sigrid.
Nice to meet you.
Right.
So today we're going to be doing your full physical exam, head to toe. So we do this annually, as you know. And do you have any questions for me before we get started?
No.
No? Okay. So I have a few questions for you.
Okay.
First of all, since our last exam last year, have you noticed any changes to your health?
Yeah, nothing changed.
No changes?
Yeah.
Okay. Okay, I noticed that you were on blood pressure lowering medication. Are you on any other types of medication right now?
Just this one.
Just that one?
Yeah.
The ARB. Okay. Do you drink any alcohol?
Sometimes.
How often do you drink
Yeah,
alcohol?
about 1 or 2 weeks one time.
Okay. And how many glasses do you drink?
About 1.
Okay. Good. Do you smoke?
No.
No smoking. Good. Any other drugs that you use?
Yeah, no, just high pressure drug.
Okay. Okay, sounds good. Okay. Any questions about your health, or any questions for me at all before I get started?
Oh, nothing.
No questions.
Yeah, you can
Okay,
begin.
sounds good. So I'll explain as I go so that you are comfortable.
Okay.
First, I'm going to start with just checking your general appearance. Okay. And it looks like you are fairly healthy, that your skin is well perfused. I don't see that you have any trouble breathing or anything like that, so that's very good. I'm going to go ahead and start taking your blood pressure.
Okay.
I'm just going to use this arm right here. Do you take your own blood pressure at home?
Yes, every day.
Every day? Good.
Yes.
Okay. I want you to just relax your hand on here. Good. Actually, I'm going to put it down first, and I'm just going to check your pulse. Please raise your hand and pump your fist 10 times for me. Good. Okay. Just gonna have you relax your arm on mine.
Yeah.
Good. Okay, so I got 140 over 75. So it looks like your blood pressure is fairly well controlled by your medication. Your systolic is still a little bit high. So we have to make sure that you stay on that medication.
Yeah.
And if it stops working for any reason, we might have to add another medication on top of that.
Okay.
Are you exercising regularly?
Yeah, it's I was for the walking and also go to gym.
Walking and gym? How
Yeah.
often do you walk and go to the gym?
1 or 2 days ago, one time.
Okay. Almost every day. That's very good. And how has your diet been lately?
Is little bit better than the before.
Okay. What kind of stuff do you eat? Breakfast, lunch, dinner?
Breakfast is mostly is like egg and vegetable,
Good.
meat, something
Very
like
good.
that.
And then for lunch?
For lunch is like almost rice and also veggie
Rice,
and fish or meat like that.
fish and meat. And is your dinner similar?
Almost same.
Almost same? Okay.
Yeah.
Sounds like a very good, well-balanced diet.
Mhm.
Very good. Do you drink dairy? Do you drink milk?
Yes, this
Yeah.
morning I'm gonna drink a little bit.
Did you realize you have any issues with it or no problems?
No problem.
Good. No problems with dairy. Okay. I'm just going to take your temperature. Have you had any fevers lately?
No.
Good. Just going to put that in your mouth, under your tongue. Good. And then close your mouth. And you can just hold it. Good. Okay. And I'm just going to take your pressure here. I mean your pulse. Take a look. Good. Temperature is perfectly normal. So is your blood, your heart rate and your respiratory rate. That's very good. Have you had any trouble breathing lately?
No.
Okay. All right, so I'm gonna go ahead and wash my hands. I'll be right back.
Okay.
Okay, so I'm just going to check your skin, if you don't mind.
Yeah.
So I'm just gonna start by checking your hair, actually, and see if there's any areas of hair loss, which I don't see, so that's good, especially at your age. Most of the time, men have, you know, their hairline starts receding, but yours actually seems quite good. I'm just looking for any lice or any kind of nevi at all inside your hair, because sometimes people don't notice it. There's a little red bump here, but it seems pretty benign. Okay, good. And let me just take a look at your face. Come over here on this side. Have you noticed any new, new spots on your face? Have you noticed any new spots? No? Okay. Just checking, and this is just from your shaving, right? Okay, good. Okay, I'm just gonna check your arms as well, and looking for any nevi that might be concerning. This is just what happened here, little scar. Did you hurt yourself?
Yeah, it's something.
Here too?
Yeah.
Okay. No worries. Moisture seems good. I don't feel any dry skin either. Little bruise here. Is that from working out? Again, I don't see any nevi that are, asymmetrical or very large. No dryness. Good. Okay. No nevi that are suspicious. Okay. I'm going to continue looking at your face. I'm actually going to take this off if you don't mind. And we'll need that later, actually. So I'm just looking at your eyebrows. There's a little bit of lateral thinning, but overall symmetrical. I don't see any drooping of the face. It's fairly symmetrical as well. Okay, very good. I'm going to go ahead and take a look at your eyes.
Okay.
So I'm actually just going to lower this a little bit. Please look up for me. Good. Okay. Can you look down? Good. Okay, there's a little bit of what we call, it's sort of caused by high cholesterol. Do you have high cholesterol by any chance? I don't remember from your records, you do? Okay, we'll have to order some lab work later to make sure that we check for that. But basically I see just a little half ring on the top that can suggest that it's because of high cholesterol. Have you had any issues with your eyes? Have you had any problems with your eyes? No?
Yeah.
Please look straight ahead like this. I'm just going to look. Please open up your eyes and just look straight ahead. I'm just going to look at your cornea and your lens and your iris, looking for any shadows, any exudate on the other side as well. Please open up your eyes a bit more. Good. Okay. I'm also going to check your pupillary reactions, so just look straight ahead again.
Yeah.
And I'm just looking at the reaction there, and then on the other side. Good. Okay. Good. And on the other side. Good. I'm also going to do a cover-uncover test. So I'm just going to have you look forward for me. Okay. And I want you to just look straight ahead. Good. And here I'm just looking for any movement of the eye to the side laterally, which I don't see. So it's symmetrical the whole time. It's very good. I'm also going to do a peripheral visual test. So in this test, what I'm going to do is we're both going to close this eye here, just like that. Okay. And then you're going to look straight at my eye here.
Yeah.
Look directly here. So you're going to let me know when you see my fingers like this. Okay?
Yeah. I can see. Yeah.
Okay. Tell me when you look straight at my eye.
Yeah.
Tell me when you can see it.
Yeah, I can see it.
Okay.
Yeah,
Tell me
I
when
can
you can
see it.
Okay. And I'm going to keep...
Change the
No, same one. Tell me when you can see it.
Yeah, I can see.
No, look at me.
Yeah. No, I can see.
Okay, good.
Yeah. No, I can see.
Good. You're going to switch eyes again. Look straight at my eye.
I can see.
Good.
I can see.
Good.
I can see.
Good. Look straight
I
at
can
my eye.
see.
Good.
I can see now.
Okay.
I can see now.
Good. Perfect. Okay. So peripheral visual test is intact. Okay. Good. So I checked for consensual convergence. I'll actually do that right now. So for this test, I'm just going to bring this close to you. You're going to look at this and then look behind you, okay? So look at this, look behind. Look at this, look behind. Keep looking, keep looking, keep looking at this. Good. One more time. Okay. I think your right eye is a little faster and the left eye is lagging just slightly. I'm just going to make a note of that. For the accommodation. Okay. For this test, it's called the H test. This test, you're just going to follow this light, okay?
Okay.
And don't move your head, just follow the light. Just use your eyes and look at it. Look here. Look at it. Yes. Keep following me. Good. Good. Okay, good. Good. And back. Perfect. Okay, so all your extraocular muscles are working well, the cranial nerves as well. That's good. Okay. I'd like you to put these back on, please. Okay. For this test, we have a Snellen chart. I'm going to have you close one eye like this. We're going to bring it up close, and you're going to read to me the lowest line that you can see clearly. So can you read this line?
No.
You read this line?
No.
This line?
This one. No.
Okay. Can you read this one up here?
Yeah.
Can you read it for me?
Oh, it's hard.
This one?
I can read this one here.
Can you read this one?
Oh, yes. No, I can't see.
Can you read this one?
No. Okay.
Okay. Can you read this one?
8, 7. Oh, no.
Okay, we definitely have to get those glasses checked. I want you to switch to the other eye. Okay, just gonna bring it closer again. Can you read this one?
Wait.
Okay.
Okay.
Let me just bring this closer again.
If we take off, we can see that.
You can, okay, so the eyes, so this is actually far-sighted?
This is for far.
Ah, okay. So we'll just do regularly. Okay, so again, we'll try this eye. Can you start with this one?
No, I can see that.
This one?
3, 7, 4, 2, 5, 8.
Good. And then these arrows?
Is here, up, and this way.
Good, and then?
XXO.
Good, okay. So
Right,
this
two.
eye is 20, 30. Switch to the other one, please. Okay. Can you read backwards? This one?
Yeah.
Read
Is
backwards.
O, XX, E, W, E, 8, 5, 2, 4, 7, 3.
Good. Can you read this one?
Yeah, it's OOX. This way, down and up. 5, 2, 8, 7, 3, 5. 3, 9.
Okay, perfect. Thank you very much. So it looks like your right eye is actually 20/25 vision, and your left eye is 20/30 vision. Okay, and that makes sense because your eyes are far. These are for far vision.
Yeah.
Okay, that makes sense. All right. And finally, I'm going to check the inside of your eyes. Okay. Okay. So I just want you to look straight this way, back there. Okay. And I'm actually just going to look directly into your eye, looking for that red light reflex. Perfect. And coming in closer. Keep looking straight ahead for me. Good. Okay. Beautiful. Okay, keep looking straight ahead. Okay, good. All right, I was able to see your arteries and veins, and they look perfectly healthy. The physiological cup, the optic cup, is also a clear outline and everything like that. I'm going to come over here on this side now, okay?
Okay.
So I just want you to turn a little bit facing. Okay.
Yeah.
So again, look straight ahead over there. And we're going to do the same exact thing, okay? Look straight ahead for me. Good. Perfect. Beautiful. Okay. Good. Just coming a little bit more to the center to look for your cup. And then, good. Okay, how are your eyes?
Okay.
Okay, good. Okay, so I was able to visualize everything, and there were no abnormalities that I could see. No drusen spots, no exudates. Good. Next, I'm going to check your ears. I know we did a checkup for your ears recently. And how are they feeling right now?
It's good.
They feel okay? Just gonna pull on your ear slightly and... Okay, there's a little bit of scarring on this one. A little bit of cerumen and redness, but overall it doesn't look too bad. The eardrum is definitely intact. Okay. This is the one that usually causes you problems, this one here.
Yeah.
Let me look over here on this side. Okay, this one looks a lot better, for sure. Oh, I see a few hairs in there. Okay. Might have to get a little bit of a cleaning done. Okay. Thank you. Okay. Now I'm going to take a look at your nose. Okay. Okay. I want you to hold one side of your nose. Use your finger and just hold one side of your nose. Yep. And just breathe out. Okay, is that okay? Relax. And then other side. Breathe in and out. Okay, good. Do you have any snoring? Do you snore?
Yeah.
Okay, every night?
Almost.
Almost every night. Have you ever gotten it checked out?
Yeah, I checked before.
What did they say?
They give me some equipment before I used it.
Did it work?
It's hard for me. No, I don't use that.
I see.
Yeah.
Okay, I'm going to take a look inside. I'm just going to push this open slightly. Okay, I don't see any discharge. The color is normal. Good. Look on this side. Okay. Good. I do want to also palpate your sinuses. I'm actually going to percuss first. So let me know if you feel any pain.
Okay.
Any pain?
No.
Good. Any pain here?
No.
Okay. Any pain? Any pain?
No.
And what about that?
No.
Okay. All right. I'm going to quickly wash my hands. I'll be right back.
Okay.
Okay. Now I'm going to take a look at your mouth. Please open up your mouth for me. Taking a look at your teeth. You seem to have one silver tooth over there. I think we've seen that before. Otherwise, I don't see any obvious cavities, no signs of ulcers or... Okay. Can you say ah? Let out your tongue. Say ah. Tonsils are normal, grade 1. Perfect. Can you put your tongue, touch the roof with your tongue? Good. Just looking down. Perfect. And then bring it down and then look up. Your hard and soft palate. Okay, great. No abnormalities of the throat. Tonsils, grade 1. No ulcers or nevi. No signs of oral cancer. Okay, good. Now I'm going to go ahead and check your neck. So in this case, I'm just going to be first checking for your lymph nodes. Okay. Check on the back here. Let me know if you feel any pain or tenderness.
Okay.
Angle of the mandible. Let's check that. Down here as well. Okay, that's just your gland. That's okay. Any pain here?
No.
Good. Okay, I'm going to check your cervical lymph nodes. Okay. No enlarged lymph nodes there. That's good. And the posterior ones. Okay. Okay, so I'm going to have you just crane your neck like this slightly, and we're just going to go in a little bit deeper, okay? That's good. Good. We're going to come to this side over here. Okay. Good. Okay. Can you shrug your shoulders like this for me? Okay, relax. Good. Okay. All right, I'm going to check your trachea to make sure that's symmetrical. Okay. And I'm just going to have you take a sip of water. Drink some water.
I drink it.
Drink it. Okay, swallow. Okay, good. Just look straight ahead like this. Just checking for any shadows. Okay, I'm going to go ahead and palpate your thyroid. So I'm just going to have you move like this. Good. I'm just going to move that and just feel the gland. Okay, other way. Don't feel any nodules. Feels very smooth. Good. Okay. No nodules. Smooth texture. Symmetrical rise. Okay. So I'm going to go ahead and check some of your muscles right now.
Okay.
I just want you to push into my hands. Push into my hands. Good. Push into my hands. Good. Push. So like this. Push into my hands. Good. This way. Push into my hands. Good. Grip my hands. Grip them. Good. Perfect. Okay. We're going to do a little bit of range of motion. So I'm just checking to see if there's any issues. Have you had any issues with your shoulder at all?
No.
Okay. There's a little limited range of motion here. And a little bit of tightness back there as well. Okay. Is that as far as you can go? Okay, good. Now I want you to bring your arms out like this. Good. And back. Okay. Bring your arms down like this. Good. Up. Okay. And I want you to bring your arms out like this. Like this. So, like this and like this. Good. And then, like back like this. Okay, good. Perfect. Good. Just gonna check your hands and your nails. Have you had any problems with your nails?
No.
I don't see anything. Okay, just check your capillary refill. Good. Okay. Perfect. Okay. I don't see any abnormalities of the joint. Do you ever have any joint pain?
No.
Okay, good. Can you do this for me? Okay, perfect. Okay. So I also, one more thing, I just want you to bring your fingers together like this. Yeah, just like that. Good, perfect. No clubbing of the fingers. Clubbing, capillary refill is normal within normal range. Okay. Here's another test we're going to do. You can just turn around slightly towards me. Perfect. So I'm going to have you put your hand to your nose and then touch my finger, okay? So put your finger to your nose, touch my finger. Back to your nose, back to your nose, touch my finger, faster, back to your nose, touch my finger, back. Faster, good, good, good. Yep, good. Okay, now we're gonna do this. 1, 2, 3, yeah, as fast as you can. Faster, 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 faster. Okay, perfect. Okay. Alternating hand movements and point. That's good. Okay. So we are going to do some percussion at the lungs. I'm going to start up here. And right now you don't have to do anything. Just listening. Please hug yourself like this. Good, like that. Just to take. Good. Okay. Good. Now I'm going to do some auscultation. Every time that my stethoscope touches your skin, I want you to breathe in and out, okay? Breathe in and out. Good. 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 Okay. Good. Okay. And just 2 more. Good. 1 more. Perfect. So all the sounds were vesicular and clear in all lung fields. Now I'm just going to bring my hands at your area. Okay. Take a deep breath in and out. Good. Okay, so for this part of the exam, I'm just going to be marking where your diaphragm goes. So again, I'm going to start 7. Okay, I'm going to start here, and I want you to take a deep breath in and hold it, okay? Deep breath in and hold. Okay, release. Okay, I want you to take a deep breath in, release, alt release, and hold, okay? Okay, good. Release, please. Okay, I'm going to do the same thing on the other side. Take a deep breath in and hold. Okay, release. Deep breath in, release, and hold. Okay, release. We're going to try one more time on this side. Take a deep breath in and release and hold. Okay, release. Okay. I'm just measuring, okay? So I have 8.5 on the right and 7.5 on the left. So your diaphragmatic excursion is actually quite good. So we are going to just let that go. All right, and now I'm gonna have you lie down this way. So I'm gonna go ahead and start percussing up here. I'm just looking for resonance. Perfect. Try that one again. Good. Okay, other side. Perfect. Okay. Same thing, I'm going to listen to your breathing. So every time my stethoscope touches you, breathe in and out, okay? Breathe in and out. Good. 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 In, out. Good. Breathe in and out. Good. In and out. Good. Okay. And do the other side. Breathe in and out. Good. 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 Perfect. Okay. All your sounds are vesicular and they are clear. I don't hear any kind of bronchi, any wheezing, anything like that. It's very good. Next, I'm going to check your heart. So similar. First, going to listen with the diaphragm, and we're going to start on this side. Okay. You don't have to, just normal breathing. Good. Okay. I'm going to switch to the other side. Listen for any murmurs. Good. 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 All right. Just going to palpate the point of maximal impulse. Okay. Very good. And I'm also going to listen to your carotid arteries. Just listening for any other side. just going to do a quick palpation. Very good. Risk 2 pulse. And both sides are symmetrical. Very good. Okay. We're going to move on to your abdomen exam. And for the abdomen exam, I'm just going to drape down here. Okay, so I'm going to go ahead and auscultate your bowel, looking for any bowel sounds. Okay. A few more bowel sounds on this side. Nothing too alarming. Okay. Good. I'm going to percuss. Let me know if you feel any pain. So far it's all timpani. It's a little bit of dullness there. Timpani. A little bit of dullness there. Upper right quadrant. And the coast margin. And 5 centimeters. Okay. Now I'm going to go ahead and palpate. Let me know if you feel any pain or any discomfort at all, okay? Start superficial. I'm just going to go a little bit deeper here. I don't feel any masses. I'm going to go deep. Okay, just relax. Okay, relax here. Okay. Okay. All right. Okay. Just gonna percuss for your liver. Okay. And sternally, start from up here. just going to do a quick measurement here. Okay, perfect. Just write that down. And clavicular, and external. And now I'm going to palpate your liver. Actually, for this portion, I just want you to raise your perfect. Good. And then I'm just going to hold on to here. Take a deep breath in, please, and out. Breath in. Good. Relax. So I was not able to feel your liver, so that means that your liver is not enlarged. That's a very good sign. Next, I'm going to be palpating for your spleen, okay? So again, I'm just going to start here. Deep breath in and out. 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 No, can't palpate your spleen. That's perfect. I'm just going to come on your other side. Okay. Just looking for your last intercostal at the level of your mid-axillary. Okay, take a deep breath in and out. Good. Perfect. Okay, so we're gonna just do the last couple of tests. I'm gonna be checking for your popliteal pulse. I'm just gonna bring this over slightly. I'm just checking. Perfect. The one. Perfect. This pulse. Then I'm going to check for your posterior tibial artery. Good. Other side. Just relax. Perfect. So just checking the condition of your peripheral circulation. And there I can feel it. Just looking for your dorsal pedis now. Perfect. And first two pulse wrong with that. And finally I'm going to check for your Babinski reflex. So just looking to see if your toes are curling, and perfect. Great Babinski reflex. Perfect. Okay. Okay, Shafet. So we are done your physical exams for today. Do you have any questions for me at all?
No, thanks.
No? Okay. Okay. So I will actually give you a requisition for some lab work so you can get some blood tests done, a urine sample and all of that. And then once we get the results, we'll call you back into the office and we'll discuss everything, okay?
Okay.
Okay. Thank you so much.
Thank you.
Take care. Have a good day.
Bye.